Genetic counsellors are experts in helping families to understand really complex genetic information resulting from the genetic tests that have been done as diagnosis tests, and explaining those to patients to break down the jargon and to help them understand what that means for themselves and for the rest of their family, and for making decisions for their future, and for deciding sometimes about what they need to do to keep themselves healthy in terms of screening or management of a condition, or about what to do when it comes to having children. And so genetic counsellors are able to integrate all of the different bits of information from the science, the health side, and also to help them with the worries and anxiety and family communication issues, to integrate all those things together to help families have a way forward. A difficult case that comes to mind was a couple who had conceived and the pregnancy was going along fine, but then quite late in the pregnancy, during one of the scans, some abnormalities were noticed, and further testing diagnosed a rare recessive condition which was really very serious. And so the couple made the really difficult decision to terminate that pregnancy. It was quite late in the pregnancy, so that was really traumatic. They then conceived again naturally not long afterwards, and that time, because the diagnosis was known, they were able to have a CVS early on, and it showed a second affected pregnancy, and they had a termination earlier this time, but it was still really traumatic for them. I got involved in the case when they were trying to come to a decision about what to do next, having gone through two really traumatic terminations, one late and one early, and they were considering whether they would want to then go down the route of PGD, which obviously would take them out of the scenario of having to have prenatal diagnosis and termination, but would put them into a situation of having to go through IVF for PGD testing, even though they were fertile and didn't really like the idea of medicalising things that far. Those very difficult decision-making processes was what I was helping them to work through, the pros and cons of those different options.